In March 2020, the first COVID-19 case in the country was confirmed and the patient was admitted at Entebbe Grade B Hospital, which is a referral facility for 5 districts. As the number of the infections grew, the hospital admitted many to its 200-bed special ward, and eventually, as the numbers decreased, the hospital opened to some outpatient departments, though the dental and the eye clinic remained closed.
So we have not fully opened up, but we have given at least 1 day in a week to cater for those patients.
Mubiru says that part of the COVID-19 ward was reclaimed and the bed capacity was cut from 150 to 45 to cater for other patients.
Partly the staffing issues, and then the other two. So we're also still looking at the COVID patients.
In just a space of 3 weeks, the facility is full, and Mubiru says this wave raises questions because 15 of the 45 patients are admitted to the intensive care unit. The administrator says the facility has run out of oxygen as 40 cylinders are used up in a single night, and they need help with their manpower as they have less than 26 health workers.
15 are on oxygen, and the 15 consume 42 cylinders in 24 hours. And how to split the thin staff on the ground and also cater for because the isolation center is a full hospital.
Mubiru says the facility could handle 30 deliveries a day, but can now handle 10 as space was taken up by COVID-19 patients who need round-the-clock care.
And the ministry is working around the clock to make sure that they give us enough supply that is required. 2, that they also make the contractor makes the final touches to open to make sure that the National Isolation Center is also open.
The hospital's beds and washrooms needed major repairs after the COVID-19 patients left in March. Today, more than 100 people who had come for COVID-19 vaccinations were returned away as it was out of stock.
We had a communication gap, but we have not vaccinated today because of the vaccine. But the country is not short of vaccines, so we are going to pick them straight from National Medical Store. We have been picking them from Wakiso district.
The hospital is now eyeing the completion of the isolation center in Entebbe for COVID cases. Despite the efforts by the Ministry of Health in combating COVID-19, there have been various frictions with the complaints of non-payment to the frontline workers in different health facilities across the country. Kamana Ivan Walunyolo, NTV in Entebbe.